Okay, it mentions that the Hangouts on air is live. I'm gonna wait 10 seconds and then I'll begin. Okay, so hi everyone. Thanks for joining us today at 5 p.m. GMT sharp. This is the evidence-based dentistry webinar, which is provided to you by International Association of Dental Students, IADS, and we're more than happy to welcome tonight Professor Melek Altan, DDS, PhD, Assistant Professor from Department of Periodontology, Okan University. And I have to also mention that she is the first woman on IADS to present us a subject and a webinar, and we're glad to do it with her, as I have seen her before and how perfect she is on the Istanbul summer camp, which maybe you guys can join the next year. And she was actually like one of the perfect. So I really enjoyed and invited her to present us on a very interesting subject that she's chosen for all of you dental students. So I'm just gonna now invite her to present us her subject. Professor, please.
Thank you very much, Sean, for this very kind introduction. Also, it's always a great pleasure to be among young colleagues. I'm very excited, in fact, tonight to be with you all, because tonight's topic is a very huge topic. In fact, what we can do tonight in about an hour is just to have a very short look at the tip of the iceberg, because evidence-based practice, in fact, is a very important part of our clinical practice. And yet it's a very big topic to talk in 1 hour, but I will try to do my best to give a clue about how we can use it, how we can implement it in our clinical daily routine. So this is all about finding the right way. And I wanted to start this presentation with a story of success. Per Ingvar Breinemark was a very young scientist in 1950s, while he and his colleagues were working on the blood flow in bone in rabbits. They were conducting an experiment, and in that experiment they used titanium implant chambers just to study the blood flow in rabbit bone. Then they discovered that the chambers had integrated with the bone so much that they couldn't remove them at the end of the study. So they called this discovery, this phenomenon, osseointegration. But at those times, osseointegration was not people were not interested in osseointegration. And Breinemark started in 1960s working on human and he made very successful experiments. But until 1980s, in fact 1983, some young scientists just were very interested in his work, and they understood the importance of osseointegration, especially for dentistry. And then an era of implants just emerged in dentistry. And now I believe that what he wished will someday will come true, and no one will die with their teeth in a glass. This is a very big success story. More and more implants are being used in dental treatments every day. This is an estimation about 2024. And when we look at the numbers, this is the US dental implant markets numbers, but the estimation is that the numbers will be, when compared to 2013 in 4. Are very important for us. And we know that its technology is amazing for us. It gives us a new way of helping patients, a new way of helping the patients, dentalist patients, with implant-supported prosthetics. But okay, we have this very good technology in our hands and we use it more and more every day. But in time, we found out that we are encountering PeriImplantitis more and more every day. So we started asking ourselves the same question. Why? But why are we seeing so much PeriImplantitis cases every day? What is going on? Okay, we know that implants are very good. We know that what they do is very good for us, and it shouldn't cause any problems for us. It should be helpful. But why are we always encountering these problems? When we check the literature, we know that our PeriImplantitis now is accepted as a man-made disease. In literature, we see that every year more and more PeriImplantitis studies are being published. And you can see that the numbers increase by years. And even now, we have some accepted literature for the next year. So what was wrong? We had a system failure. What happened? What happened was that we were unable to build a bridge between clinical practice and scientific evidence with an evidence-based decision-making process. If we were able to use the real scientific evidence in our clinical practices, we wouldn't be encountering so much PeriImplantitis cases today. So evidence-based decision-making is very important, and we know that. What is evidence-based practice? Evidence-based practice is the integration of the latest scientific evidence, understanding and implementing it in daily practice. It is the conscientious, explicit, and judicious best evidence in making decisions about the care of an individual patient. This is the real explanation of evidence-based practice. So what is evidence-based dentistry? Well, it is the combination of three components. First, the scientific evidence, clinical expertise of the doctor, and the patient's needs and preferences. First, we will go through all of these three, but the scientific evidence. What is an evidence? Well, probably you all have seen this pyramid before, because when you look at, when you search online, at least for evidence-based dentistry, what you see is first this pyramid. This pyramid is, in fact, very important for us, and we should all be familiar with these study types and what they include in themselves. Because when we read a study, we should be able to interpret them, and we should be able to understand which study is more important to us than the others. So we'll go through all of these studies. This pyramid gives us the level or the quality of the evidence. When you go up the pyramid, the level or the quality, let's say, increases, and the risks of bias decreases. What do we mean by that? Let's check that. We're going to look at each one of them very shortly, just to know the cons and pros of these studies. In vitro research it's a Latin term. In fact, it means within the glass. It's an experiment that's taken in the laboratory conditions. Refers to the technique of performing a given procedure in a controlled environment outside of a living organism. As it is not in a living organism, you can really easily understand what kind of bias there can be with these studies. They are not in a living organism. So in real life conditions, the study results may change. Then the second one is the animal studies, of course. Animals are used in these studies in research when there is a need to find out what happens in the whole living body, which is far more complex than the sum of its parts. But of course, there are some key problems here too. Especially with animal species, we know that there are a variety of metabolic pathways different than humans. Especially in drug studies, these are big problems for us. Different models for inducing illness, also with varying similarities to the human condition, can be a problem. Drug dosing schedules and regimes of uncertain relevance to human conditions also can be a problem. And differences in laboratory techniques that are being used in these type of studies may influence also the results. So, okay, making the experiment in a living organism may be important when compared to an in vitro study, but animal studies are not exactly what we want to have at the end. So we go one step forward and we have editorials, opinions, and ideas. These are in fact invited comments on a paper. But the problem here is that they depend on the experiences, observations, and opinions or knowledge of the writer. So yes, these are a little bit closer to what we want, but not exactly at that point. Case reports, on the other hand, may be a little better for us because they give a detailed report of the symptoms, signs, diagnosis, treatment, and follow-up of an individual patient. But we are talking about an individual patient, which means that the conditions of that patient may not be the same as the conditions that we may encounter in our clinics. So it can give an idea about maybe a treatment, but it's not always applicable to our patients. Then we have case series. Case series is a descriptive study design, and it's just a series of cases of any particular disease. These cases are described to suggest at best a hypothesis. However, there is no comparison group in here, so you can't draw too many conclusions from these studies. But in terms of generating evidence regarding various aspects of the disease, a case series is a very weak study design, we may say. When we go up, we have case control studies. Well, in case control studies, the researcher looks back to identify the factors or exposures that might be associated with the illness. They often rely on medical records or patients' recalls for data collection. But these types of studies are often less reliable than the studies we are going to be talking about. Let's go one step forward and we'll have cohort studies. Well, cohort studies are analytical and observational studies and are mostly prospective. It's conducted in the population and mostly a random sample of the study population is classified according to the exposure status and then followed up for a period of time. The group is divided into two, for example. One group has the exposure and the other one doesn't. And in time, you search for an evidence of illness. And these are very good studies, in fact, but there are some problems with these cohort studies too. They are not as reliable as randomized controlled studies, since the two groups may also differ in ways other than in the variable under study. So there may be other variables during the study that affect the results of the study. Now we have the randomized controlled trials. Okay, these are very important studies. In fact, this is a type of study in which the participants are assigned by chance to separate groups. Neither the researcher nor the participants can choose which group. Blind. This reduces the potential for bias and allows for comparison between intervention groups and control groups and provides sound evidence of cause and effect. So these are the studies that we should be looking for usually. But of course, systematic reviews are a little bit stronger than RCTs. This type of systematic reviews summarizes preferably controlled trials, and they provide a high level of evidence on the effectiveness of healthcare interventions. Judgments may be made about the evidence and inform recommendations for healthcare, which we will be talking about sooner. And meta-analysis, of course, these are the, let's say, gold standard, the best study types that we have to be looking for. A meta-analysis is a method for statistically combining the results of studies that were included in a systemic review to come to a conclusion about the overall effects of an intervention. In fact, it's just like a systematic review, but meta-analysis combines the data of these studies in a way, statistically and mathematically, in a way that they present the results as if all of them were just one study. The problem here is that it's not possible to find a meta-analysis for every question you have in your mind. So we should know all the types of studies and what they can give us, what they can't give us, so that it will be easier for us to interpret these studies. So now we have different kinds of studies, very good, and we have to use them, but how are we going to use them? So there should be some stages of using them. What are the stages in evidence-based practice? When you search for evidence-based practice, you're going to see that these are there are the 6 levels, let's say, steps of evidence-based practice. And first of all, you have to identify a clinical problem, then produce a focused clinical question, search for the evidence, evaluate the evidence that you find, and incorporate evidence into your practice, and then evaluate the impact of what you did on your practice and patient. We're going to go through all of them one by one. Now, I'd like to ask you a question. How many questions do you ask yourself about your practice during a day at the clinic? I know that you are students, but you will be having more patients every day. So you now have questions, but even if you graduate, even if you practice for 20 years or so, you're going to always have some questions on your mind. When you treat a patient, when you start treating a patient, when a patient is sitting on your chair, you're just making some decisions about the treatment procedures. But sometimes you have questions on your mind. You do something, but you ask yourself, is there another way to do it? Are there any other options to do it? Is this option the best option for my patient? You always have these questions in your mind. I had a little search in internet and found some studies about that. In 1999, Elby and colleagues found out that clinical questions arise 3.2 times for every 10 patients. Or in another study with primary care physicians, Cowell and friends found that during a single day, 8 important clinical questions arise. So we all have questions. But what we have to do is not to forget them, to write them down, maybe right after that patient, because we know that when you're finished with the patient, you just focus on the next patient, on the next thing that you're going to do. So before forgetting your questions, you should take maybe little notes about your questions so that when you have spare time, you can look for them, you can search for answers for those questions. But how are you going to do that? Because when you identify a clinical problem, it is very important to produce a focused clinical question to get the right answer. As Enro once said, a good part of the trick to being a first-rate scientist is in asking the right questions, or asking them in ways that make it possible to find answers. If you don't ask the right question, it is not possible for you to get the right answers. So we're going to start by asking the right questions. How are we going to do that? For evidence-based practice, there is a, let's say, skeleton to produce a question, which is called PICO, or in some cases, PICOT. P stands for patient or population, I for intervention, C for comparison, O for outcome, and T for time. If you are just a clinician, producing a PICO question is easier for you, but if you are an academician, there are lots and lots of different ways to produce a PICO question. There are some, let's say, ways, frameworks for us to produce a PICO question. But in the clinic, when you're working in the clinic, I just wanted all of them to be in this presentation so that you can find it again when you look for it. But probably during your clinical practices, the most question that you're going to ask will be the first one about interventions or therapies. So I just wanted to give you a little example to make it a little bit more clear. This is, as I'm a periodontologist, of course, the examples that I'm going to give will be from periodontology. So this question is about an aggressive periodontitis patient. I have just colored it to make it a little bit clear. Periodontitis patients, which is the patient, is the effect of treatment with PRP and hydroxyl. The intervention parameters, the outcome, graft alone. This is the comparison. You can add some time in. Mostly you will find PICO questions without time. So this is just an example. You can create a focused question to know what to search for. The next step will be searching for the evidence, of course. To search for the evidence, you should be using internet very in a very good way, but how you need. There are some databases that you can find what you're looking for. Of course, I have put PubMed at the first, this is the first one I wrote, because PubMed is mostly used by clinicians and academicians. But Cochrane Library is also another gold standard, we may say, because there are very good reviews in there. You can search for it. You don't have to be a member of Cochrane Library to just reach for the studies. Also, there's Science Direct or ADA's Center for Evidence-Based Dentistry. I would like to talk a little about Cochrane because it's important to know about Cochrane. It's a non-profit, international, independent organization formed to organize some medical research findings so as to facilitate evidence-based choices about health interventions faced by health professionals. There are some other databases, of course, like Scopus, Google Scholar, Embase, or CINAHL. Depending on your country, probably you may have different databases too, but these are the mostly used ones. So I just wanted them to be in this presentation. I will be giving some examples about PubMed during the presentation. So how will you search for the evidence? Okay, you now have the question on your mind. You have organized it in a way that it will be easier for you to find it with a PICO question. So now what are you going to do? You open the PubMed and you're waiting with your computer. What you have to type is, we'll start with the elements of PICO. And then you can use Boolean operators, truncation, wildcards, phrase search, or mesh words or M3 medical terms to narrow your search. What are all these? We now know that we now know the elements of PICO, but these Boolean operators, truncation and wildcards, are not usually used, but they are very useful to narrow the search. Mesh words are some standardized words for Medline, and M3 medical terms are for Embase. So when you enter PubMed, if you have a mesh word, for example, gingival recession, you can write it down, and that mesh word will give you all the studies about gingival recession. I'm going to talk a little about these four things that we can use for our studies. The first one is Boolean operators. Okay, let's say A is periodontitis and B is smoking. If you want studies, all studies about periodontitis and all studies about smoking, you have to write periodontitis or smoking. If you want studies just about periodontitis and smoking, periodontitis and smoking, you have to write and. If you want studies with periodontitis but not with the effect of smoking, so you have to write periodontitis, not smoking. These are the Boolean operators that will make it a little bit easier for you to narrow your searches. The next one is these three. You can use truncation. So truncation is used for, if you write cell and truncation, this is a very good example, I guess. You will get the results for cells, cellular, and so. Or for example, if you write gingiv and a truncation, you put a truncation, you get the results for gingiva, gingivitis, and everything starts with gingiv. So truncation may make it easier for you to, let's say, widen your search. Wildcards also are used for replacing characters, but this depends on the database, so you should be careful about that. Some databases use one wildcard for one letter. Some use one wildcard for 3 letters. So you should be familiar with the databases wildcard use. Phrase search is something that you can do to again narrow your searches. It searches as a whole because you use quotation marks at the end and at the beginning of your phrase. And then you can search as a whole what you are looking for. Now, when you do all of these, you get a list of studies in PubMed, for example. What you have to do first is just to read the topics of the studies very quickly, and then eliminate these studies first. And then, as a second step, you have to read the abstracts of these studies. And finally, you will have your evidence. But you have to read the full texts of these studies, if possible, to get the real, to get what the study really will give you. So let's have a hypothetical patient here, like Mrs. Brown, let's say. And also the example will again be about periodontology. Let's say that Mrs. Brown has come to the clinic with hypersensitivity. And she says, I have a very, I can't eat anything cold or hot, I feel hypersensitivity. And you examine her and you find out that she has some gingival recessions. So you're going to maybe do some surgery for her treatment, but you have a question in your mind. She's using a manual toothbrush. Maybe I should be changing it to power toothbrush, or should she go on with a manual toothbrush? Is the use of power toothbrush an option for her if she's going to have an operation? And you have these questions. What you have to do is, okay, we're just going to go back to the beginning of the presentation. We identified a clinical problem, and we should produce a focused clinical question for Mrs. Brown. In this case, if you want to produce the question, it should have the P, which is the gingival recession. The patient with gingival recession is P. You should have the intervention with the use of power toothbrush. You should have an outcome like clinical parameters, and you should also have a comparison like a manual toothbrush. So the question comes, in a patient with gingival recession, what is the effect of power toothbrush on clinical parameters? when compared with manual toothbrush. Here you are. Now you have a focused clinical question. What you have to do is to search for the evidence. Now I'm just going to leave the presentation for a while, and I'm going to use PubMed, possible, okay, we're going to, okay, now we're in PubMed. So what we want to learn, what we want to find is gingival recession, and I'm using a Boolean operator, power toothbrush, because I want the studies with gingival recession patients used power toothbrush. So I say search, and I got 11 items. Okay, just there is a limitation here. Okay, now I have 11 results for my search. But then I say, okay, I have 11 studies here, but I want the studies with only humans. Let's limit our study, our search, and now we have 7. Maybe, I don't know, I'm just giving an example. There are studies that are done around implants. So I don't want implants. I write not implant. And I have now 6, okay, and one of them was around an implant. And also I want, as it was in my PICO, I write again a Boolean operator and manual, of course, manual toothbrushes. Okay, and we have 5 results. What we're going to do now is just have a quick look at the name of these studies. We have a systematic review here, which is very good, we know that it's when you think about that pyramid, it's on the upper levels of the pyramid, so this is important for us. And there is another study in here, prospective clinicals. Okay, we have another systematic review too. So there are 2 systematic reviews about the question that I had, and 3 studies I have. So I just have a very quick look. And okay, my initial phase of periodontal therapy, I was thinking about surgery mostly. And okay, all these studies may be very useful for me. So what I have to do now is to go up again and choose the abstract and have their abstracts here. So now you have the abstracts. It's not, I know, possible for us to read all of these now because we don't have enough time to do all that during this presentation. But what you have to do is that just read the abstracts and get a clue about the studies. And then if you need, just have their full texts and read them again in a way that you can critically appraise them, which will be the next part of our presentation. Okay, now we have searched for evidence for Mrs. Brown. What we have to do now is to evaluate all the evidence that we had after this search. We're going to interpret these studies. We are going to do a critical reading. Very of space dentistry, because there are lots of ways to do that. If you are a clinician, probably you will not have to use all of these, but if you're going to be an academician, these will be a part of your daily routine, let's say, to use these assessment tools. Online, you can find some assessment tools to interpret, to critically read these literatures. These are, in fact, checklists or flowcharts that are design specific. And by design specific, I mean, for example, Quorum is an assessment tool to interpret, to analyze the studies that are meta-analyses or systematic reviews. But if you're reading a cohort study, for example, what you have to use is STROBE, probably. You can use these assessment tools, but as we are now talking about the clinical use of evidence-based dentistry, it is not very easy to use these assessment tools because there are about 20, 25 questions that you have to answer while reading these literatures. And even for the case of Mrs. Brown, you have to read 5 full texts. You have to analyze all those full texts with these assessment tools, which will, of course, take a lot of time. And in your clinical practice, when you have patients and patients and patients, one by one, just waiting in the waiting room, of course, it is not possible to take out all these literature and have their assessment tools and read them and interpret them and then decide on what to do to Mrs. Brown. Is not easy. So I have found another study by Shekel, which is, I think, a little bit more useful for a clinician. Of course, if you're, again, I'm saying, going to be an academician, you're going to use the tools that I have aforementioned. But if you're just going to be a clinician, these 4 questions are the questions that you can ask while reading a study. The first one is, does this study address a clearly focused question, like the ones we have produced before? Did the study use valid methods to address this question? Are the valid results of this study important? And by important, I mean, do they make a difference? And most importantly, are these valid, important results applicable to my patient? What do the results mean to me? Are they real and relevant that can be applied in my clinic? So we go to the next step, incorporation of the evidence into practice. But wait a minute. Here I think there is a problem. If we read, if we find the question, if we read the evidence, and if we decide on what to do, what happened to the patient? When we described evidence-based dentistry, we said it is the combination of 3 circles. Remember those 3 circles: the evidence, the clinical expertise, and the patient preferences and needs. What happened to the patient preferences and needs if you just incorporate this evidence into your practice? Now, at this moment, we have to think about the patient too. So without decision making, we should be doing some shared decision making. Now, shared decision making is in fact a must for evidence-based dentistry because it's in the definition of evidence-based dentistry. It is shared decision making is most crucial in the final step of evidence-based practice. And without it, optimal evidence-based practice cannot occur. So we have to do this very important step before incorporating the evidence into practice. But what is exactly shared decision making? Shared decision making refers to a process in which the doctor and the patient collaborate to access relevant information and to enable patient-centered selection of healthcare resources. So we work with the patient to select the treatments based on the clinical evidence. In some cases, I know that it's not easy to do this because sometimes you only have one way to go. And then what you have to do is to talk with the patient. Shared decision making is, in fact, a conversation with the patient. This may be a little fancy way of saying that, but if you have only one way to go, then what you have to do is to talk with the patient, tell him the way to treat her or him, and then go for it. But in some cases, you have multiple ways. And when you have multiple ways, what you have to do is to sit with your patient, give him some time, explain all the cons and pros of the ways that you can go, and then have a common way of treatments, let's say, because this will improve the decision quality and also the patient satisfaction. Let's give a very, very simple example for this. You have to prescribe a drug for your patient, and there are two ways to take it. And let's say one of them is a pill and the other one is an injection. You can ask your patient about the pills or the injections and both that you can do. And then the patient maybe will say, I'm not good with pills, I just want to use injections. So you can go with it. But shared decision making will make your patient more happy at the end because in the old way of treating patients, we used to decide and we used to tell them what we are going to do, and we used to do it. But if we are going to use the evidence-based practice, then we have to consider the patient needs and preferences. So we should also be making these decisions with our patients. Now that we as the doctor and the patient have made a decision, then we can incorporate evidence into our practices. This is very important step because before incorporating evidence into practice, you should have all the data for the evaluation so that when you come to the evaluation phase of EBP, you should have the detailed information recorded about the patient. They may be photos, indices, maybe for us periodontal indices, measurements, etc., so that we can compare where we have come to. We baseline to meet these things. The patient and surely we will be happy with the results. But we said at the beginning there are three components of evidence-based dentistry. Now we talked about scientific evidence and patient needs and preferences. But what about clinical expertise? What about that? What can we talk about our expertise, our opinions? How can we have a different way of looking at the patients we have? We should be the clinicians. Clinical expertise is the accumulation of knowledge, patient care experiences, and treatment decisions and their outcomes. So Sect once described clinicians' proficiency and judgment as something that is gained from school. Okay, now you're all in universities. You're gaining some proficiency in there. But Sect also mentioned about continuing education and clinical practice experience. Now, continuing education is very, very important, especially for dentistry, because we're working with humans, and our area is an knowledge base. So we should be using it, following it in a very closely with congresses, seminars, courses, workshops, maybe meetup groups or online groups. Of course, we have talked about the evidence and the levels of evidence. Not everything you hear are correct. You should check their evidences when you hear something, but they will give you a clue about what's really going on around. We are dentists, we work in clinics, and the world is not all about us and our patients. It's not all about our experiences. We should be sharing our knowledge and experience and try to learn a lot from the others also. We should always stay connected to the world, because a lot of new things are happening. In my class, I tell my students that what I teach you today is valid only for today. Tomorrow, something very, very different may happen, and what I have told you may be wrong. So you should follow every change in our area. You should always keep yourself up to date by staying connected. Okay, these are of course very important things in our practice, but we should consider social media sites too, because it's no longer a question of if you should be using a social media site, but how you are using it. There are lots of social networking sites that you can find colleagues, share your experiences, learn their experiences, but please try to create quality content, both for your patients and colleagues. It's not just a tool for building relationship, but it's also a good tool for your business. You should have strategies about who you want to reach and what you want to do and what you are really looking for when you're using social networking sites too. So as we are reaching to the end of my presentation, I'd like to say that if a higher standard compared to where we are today, we should let the science lead us. And as Grace Hooper said once, the most dangerous phrase in languages, I think it is for dentistry too, we've always done it this way. Just don't be afraid to change and be brave to embrace the new. Thank you very much for all of you for your attentions, and it is really a great pleasure to be here with the members of IADS tonight. So if you have any questions, I would be very happy to answer them if possible.
Okay, thank you, Professor, for this amazing webinar. I really enjoyed the evidence-based dentistry, and I hope everyone, including the students, can use the evidence you gave us,
Hope so.
the clinical practice dentistry for the clinical practice dentistry.
Mm-hmm.
So I'm just gonna right now check if we have any questions. And dear listeners, if you have any questions, I'm just gonna give you like 1 minute. You can write it and comment, and I'm gonna forward them to Professor, and we'll have the answer and maybe discussion even. So I'll be waiting for your questions. And Professor, I have to say we had around 612 views till now on Facebook.
Very good.
Yeah. Okay, so I'm receiving some comments from the students that they're thanking you so much for your amazing webinar.
Thank you.
And no like real questions yet, just compliments.
Very explanatory presentation then.
Okay, meanwhile, I'm like, I have been a fan of EBD like myself. I even had a training session in our Congress about EBD in COVID. And I know that evidence-based dentistry is really cool and awesome, and it is really. But the thing is that like when I'm working on a patient, like for a patient, and like the patient comes to my clinic, I examine, and then I'm like, I want to give an immediate treatment plan. Like the patient is asking me like, what should I do, like what can I do, and like he or she is asking for immediate treatment plans from me, and I must just like give something, and there are millions of questions right in that moment in my mind. that I'm thinking to myself, okay, maybe if I search for evidence, or even better evidence, like in PubMed or in Cochrane or ADA servers, like maybe I can find a better treatment plan or something. Like, I mean, how can we make this EBD thing work like in a easy to use way, like so we can use it very easily in our daily practice?
Well, the best thing about evidence-based dentistry is that it takes time. So if you need a quick answer, we can say there are two approaches to use evidence-based dentistry in clinical practice. The first one is that when you have the question, to have the courage which is very hard, of course, to do it with the patient. The one approach is that you just search for the evidence with the patient in the clinic right at that moment. This is one of the approaches that you can use. But I think as a professional, it is not possible, it's not easy to do that, because most of the patients will think that, okay, this doctor doesn't know too much, I guess, about this treatment. They'll have question marks in their mind. So it is not very easy to use this approach, I guess. But as I told you during the presentation, if you have some questions in your mind, and if you encounter these questions very oftenly, maybe you should write them down right after the patient, so that when you have another patient like this, who is seeking for an immediate treatment, you will be ready for them. Now that most of the audience is our students, I know that there are more questions in a clinical daily routine for you, but having these questions answered right away may not be very easy when you have a patient sitting on the chair and waiting for an answer. In that case, what you have to do is just to depend on your education and your experience. And of course, as the evidence-based dentistry mentions, patient's preferences and needs. But when you have the question and when the patient leaves, if you still have a question mark in your mind, please write it down, turn it into a PICO question, and have a little search in PubMed. So when you look at the abstracts, it will take only about 10 minutes maybe, while your room is being prepared for the next patient. You can have a little and quick search on PubMed for what has been done about your question. This is what I can advise to you if you have if you're in such a situation.
Thank you, Professor, for the answer. I have also, I'm receiving one question. Is that how can we, get to the answers to the questions that we do not have the evidence for yet?
Oh, well, if you don't have any answers for those questions, well, as an academician, I would be very excited, because then you can have some studies on that. But as a clinician, of course, that's a problem. If you cannot reach any evidence about your question, which is, I think, a little bit hard, because if you search with the real, let's say, cases, I think you're going to find answers. But let's say in an extreme condition that you can't find the answers, well, again, what you can do is just to maybe ask for another expert who may have encountered such a case, because experience and sharing is also important, as we have told during the experience. But I believe that you are mostly going to find the answers if you search with the right questions. So maybe you should start first asking a different type of question to get an answer. But if in any way you can't find any, so asking to another expert may be another way of getting an answer.
Thank you, Professor.
You're welcome.
I'm receiving questions. They're typing.
Mm-hmm.
So I received one more question. Do I have to have enough experience with research if I want to write a systematic review, or can I start with writing it even before doing the research myself?
Well, writing a systematic review is a very tricky thing, in fact, because there were some assessment tools that I showed during the presentation. Yes, you should have some studies about them if you're going to conduct a systematic review about a topic, because the selection of the inclusion criteria for systematic reviews are defined by the authors. And if you are not really experienced in that topic, your inclusion criteria may cause some bias when writing a systematic review. So I think, yes, it would be better to have some studies about that, so that you and your colleagues can produce a systematic review using the assessment tools to check them also.
Thank you very much, Professor.
You're welcome.
So the next question is, if we get in some controversial cases, what's the point that should make me go for one side over the other one?
By controversial cases, what is meant? I didn't understand exactly, but controversial cases, what do you mean?
I'm waiting for the person who asked the question to write me, but I think he or she, it's a he meant that like in some cases when we have two options for the treatment, and there's like evidence for both, like
okay,
because
okay,
I'm going to choose one
okay.
another one.
Okay, now I understand it. Now you as a dentist, as a doctor, you should think about the cons and pros of both of the treatments. So at that point, what you have to do is to share decision making. What you have to do is share decision making, because you have to take the opinion of the patient also. If you have two ways to go, and both ways have cons and pros biologically to the patient, what you have to do is just to decide on the treatment with the patient, so that the patient will also feel better during the treatment phase. Especially in some treatments, maybe there are some problems that you may encounter, your patient may encounter during the treatment, and if he or she knows the process of the treatment, it will be easier for you. So if you are just in the middle of selecting two ways, well, one of the two ways, it is better to do it with the patient. Because as a dentist, as a doctor, you can decide on which one is better for the patient, but the patient should know your preference also. But it's a decision, I think, to make with the patient in that case. I hope that's clear.
It was more than clear. The quest is thanking you for the answer, and
thank you very much.
I think we don't have any more questions for now. If the viewers later, like they can watch this webinar offline, and they can, I think they can read your email here. And for more questions, anything, you can contact Professor anytime.
Of course, anytime.
Yeah. Thanks again for your amazing webinar, Professor.
Thank you very much. It was a pleasure. It was a pleasure. Thank you.
On behalf of International Association of Dental Students and as your International Scientific Officer, I thank you personally for your time, for giving us your time. And I thank our editor, Abanop, who made this thing work for us, both on Facebook and YouTube. I thank our president, Andre, for giving us his time, for making the Facebook streaming available for us. I thank Natalia, our past ISO and our current General Secretary, who is here to support us. And once again, International Dental Association of Dental Students will thank all the listeners for listening and for joining us. We hope to see you all in our next amazing webinars soon. So have a great evening or good morning or a good afternoon all around the world, and see you later.